Hello, my name is Jason Davies. I'm going to be covering a topic on the future and enduring public health challenges that we face today. Going over the lesson reviews of Chapter 11, um, some of the current and enduring public health challenges can be attributed to some determining factors. Um, some of the challenges are more prevalent in socioeconomic populations when it relates to income, education, their occupation, and what they do for their chronic disease prevention and management. Oftentimes, this is mainly attributed to their behaviors and their behavioral choices. Um, the there is um, there is a potential for these choices to be changed in these behavioral uh, management of individuals with their chronic diseases and stuff like that by um, ma- mainly through education and continual reinforcement of good life choices and behaviors. Um, According to our reading, there is a direct correlation with the amount of education and reinforcement into good habits, into the development of good habits that can drastically reduce um, individuals from making bad behavioral choices and living a certain lifestyles. Um, One of the numbers that was um, quoted in our text was that annually the United States spends 1.1 trillion in chronic health issues by reinforcement of or by shifting it instead of just treating the symptoms and the ailments. If we invest money into education and training, that we could possibly reduce the amount spent from 1.1 trillion and reduce it down to, or reduce the cost from 1.1 trillion, and with the cost reduction of about 218 billion. So roughly just under one quarter of the total price, which will definitely make a dramatic impact. Um, because some of the major uh, issues that is listed in our book is heart disease, cancer, chronic lower respiratory disease, stroke, and unintended injuries. Now, after looking up a peer-reviewed journal article, it was on diabetic retinopathy by um, Dr. Chung, all right, from the Clinical and Experimental Ophthalmology Journal. Um, One of the things that I think is most definitely a chronic or a public health issue for currently and in the future is the prevalence of diabetes. Currently, there's roughly about 117 or 171 million people suffering from diabetes. By the year 2030, according to Dr. Chung, um, that number would double. So in less than 15 years, that number would go up to 366 million, which is a significant increase in such a short time. Um, the Again, diabetes. I mean, there are type 1 and type 2 forms of diabetes. The ones that is preventable. Um, a lot of people end up with the disease based on their choices. So, again, the behavioral choices of individuals is what's ended up costing both the public health and the healthcare system much more. Um, Now, uh, it's a lot easier said than done. Um, Making behavioral choices or enticing people to make choices in their lifestyle is very difficult. Um, Me, for instance, I was a 20-year smoker, um, and I was a medic, so I knew what the damage was that was going on while I was smoking, stuff like that. But I still accepted the risk. After a while, I could see some of the changes of my smoking and what they were causing. So I made a conscious decision to quit. Now, I didn't quit on the first time. It took me multiple attempts to quit, but it was the behavioral choice of actually saying I'm going to quit. It was very very difficult because one of the main things is that you've got to want to quit. Now, if you can't translate from people from knowing that they should quit, like I was, and transitioning them to wanting to quit, that is a paramount um, point there, as far as figuring out when and how, and convincing them that it is in their best interest to quit. Um, so many of these public health issues, I think, as you start instilling in the younger generations about good lifestyle choices and good habits to incorporate within their lives, then hopefully the reduction of these chronic issues of heart disease, cancer, I think soon to be diabetes, will decrease. Now, some of the other the world uh, public health issues that were referenced within our reading was the Ebola viruses, the H1N1, the SARS, and the Zika epidemics, pandemics, and just viruses and stuff like that. Um, Many of those issues is for as far as a public health um, issue, it does also incorporate the element of of education. So, for instance, if you're going to an Ebola uh, area, do you have with you enough personal protective equipment to prevent infection? Do you have the necessary things to prevent, and that you are not voluntarily exposing yourself to these diseases, etc. The same with the Zika. Are you actively preventing the spread of these diseases? You know, the other thing for the public health standpoint is informing the community as far as what their response is to an epidemic like this. Like, so if Zika, let's say, for instance, if there is a Zika outbreak here in North Carolina, what is the public health response? And does the public know? Getting that information now, investing the information, having the local and state governments invest into this information push out to the public, I think, is key in both the prevention and the response of these issues. Um, so that really concludes my assessment and video on this this topic. Thank you very much.